So hi, I'm Dr. Khushbu Haria. I'm a counselling psychologist and I work in a community CAM setting. So in terms of it affecting ethically, I think it's made us have to think a little bit more about what we mean by therapy. And particularly because we've always used a very traditional model of therapy in terms of being in the room with the person. That's been really tricky because we've had to challenge our own thinking around what therapy is, what it means, and how we can use alternative ways of communicating with our families and young people. It's been particularly more ethically challenging in terms of working with young people with neurodiversity, particularly where we're assessing them for social communication concerns, particularly because a lot of that work needs to happen in the room. And we've always been quite concerned about how reliable doing the assessment over online, how reliable that is, and that's been very, very tricky. And we've gone very back and forth with that, and in the end we've ended up using a very mixed model where we do see the young person, but at a socially distant way of working, also doing lots of parts of the assessment in terms of the developmental history and things, taking those sort of things, being more in line with using an online format. I think it's been quite good for families, especially the hard to reach families who struggle to actually make it into CAMS. I think it's been actually really helpful for them to have a format which is much more comfortable in terms of being able to see, not having to travel into CAMS, but it's also been challenging in terms of minority groups who may not have access to the internet, or may not have a quiet space at home. I think we sometimes take for advantage maybe that we may have a spare room that is confidential, and it's particularly been really hard for young people because when they're talking about their difficulties at home, holding that confidential environment, particularly when you're talking about your own family, it can be really difficult. Whereas coming to CAMS, you are in a safe, contained environment. And I think that's been ethically really challenging, being able to assess that and be able to offer something that feels therapeutically helpful.